to De-Novo Education Pty Ltd information session. Understanding Schizophrenia. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. It is characterized by episodes of psychosis, which may include hallucinations, seeing or hearing things that are not present, delusions, false beliefs, disorganized thinking, and impaired functioning. The onset typically occurs in late adolescence to early adulthood, but it can manifest at different developmental stages. Impact on developmental levels. Childhood. In children, symptoms may be less pronounced but can include social withdrawal, unusual thoughts or behaviors, and difficulties in school. Early intervention is crucial for better outcomes. Adolescence. During adolescence, symptoms may become more apparent. This stage often coincides with significant life changes and stresses that can exacerbate symptoms. Adolescents may struggle with identity issues and peer relationships. Adulthood. In adults, schizophrenia can severely impact daily functioning, employment opportunities, and relationships. Individuals may experience chronic symptoms that require ongoing management through medication and therapy. Tips for parents to assist children with schizophrenia. Do's: educate yourself, understand the condition to provide informed support. Encourage open communication, create an environment where your child feels safe discussing their feelings. Promote routine, establishing a daily routine can help provide stability. Seek professional help, work closely with mental health professionals for treatment plans. Support social skills development, encourage participation in social activities to build confidence. Don'ts: avoid stigmatizing language, use respectful language when discussing the condition. Don't dismiss symptoms, take your child's experiences seriously, they are real to them. Avoid overprotection, while support is essential, fostering independence is also important. Don't isolate your child, encourage social interactions rather than keeping them withdrawn. Tips for teachers to assist students with schizophrenia. Do's: create a supportive classroom environment, foster inclusivity and understanding among peers. Provide clear instructions, use simple language and clear expectations to reduce confusion. Be flexible with assignments, allow accommodation such as extended time or alternative assignments if needed. Monitor behavior closely, be aware of any changes in behavior or academic performance that may indicate distress. Don't: avoid labeling the student, do not define the student by their diagnosis, focus on their strengths. Don't ignore signs of distress, address any signs of anxiety or distress promptly and sensitively. Avoid punitive measures for behavioral issues, understand that certain behaviors may be symptomatic of their condition rather than intentional misbehavior. Don't exclude from activities, ensure the student has opportunities to participate in all classroom activities. Different types of schizophrenia. While schizophrenia is often referred to as a single disorder, it encompasses several subtypes based on symptomatology. Paranoid schizophrenia, characterized primarily by delusions and auditory hallucinations but relatively preserved cognitive function. Disorganized schizophrenia, hebephrenic marked by disorganized speech and behavior along with flat or inappropriate emotional responses. Catatonic schizophrenia involves motor disturbances ranging from extreme agitation to immobility, catatonia. Undifferentiated schizophrenia, symptoms do not clearly fit into other subtypes, includes a mix of various symptoms without predominant features. Residual schizophrenia, characterized by a history of at least one episode of schizophrenia but currently exhibiting less severe symptoms. Understanding these aspects of schizophrenia can help parents and educators provide better support for individuals affected by this complex disorder. How to support a person with schizophrenia. Educate yourself. Supporting a loved one with schizophrenia requires understanding, patience, and a commitment to their well-being. It's crucial to remember that schizophrenia is a treatable illness, and with the right support, individuals can manage their symptoms and live fulfilling lives. Here's a step-by-step guide on how to offer effective support. The first step is to educate yourself about schizophrenia. Learn about the symptoms, causes, and treatments. This knowledge will help you understand what your loved one is experiencing and respond with empathy rather than judgment. There are many myths surrounding schizophrenia, so it's important to rely on trustworthy resources like the BC Schizophrenia Society or the National Institute of Mental Health, NIM. Listen and communicate empathetically, encourage treatment and adherence. Active listening is essential. When your loved one opens up, listen without distractions and give them time to express their thoughts and feelings. Avoid interrupting or finishing their sentences. Show empathy and validate their experiences, even if you don't fully understand them. For example, instead of dismissing a hallucination, you could say, "That sounds so confusing and stressful." Encourage your loved one to stick to their treatment plan. This includes taking medication as prescribed and attending therapy appointments. You can offer support by reminding them of appointments or helping them manage their medication, but always respect their autonomy. If they are hesitant about treatment, focus on specific symptoms they're experiencing, such as insomnia, to make the idea of seeing a doctor less threatening. Set realistic expectations, reduce stress, and create a structured environment. Stress can exacerbate symptoms, so help your loved one establish a routine and a safe, calm space. Encourage healthy habits like a balanced diet, regular exercise, and sufficient sleep. Create a supportive environment, encourage self-help strategies, be patient and set realistic expectations. Recovery from schizophrenia is a process, and there will be ups and downs. Help your loved one set and achieve manageable goals, and celebrate their successes. Offer practical assistance, support self-help strategies. Encourage your loved one to engage in activities that promote their well-being, such as exercise, hobbies, and social interaction. Self-help strategies can have a profound effect on symptoms and self-esteem. Recognize warning signs and develop a crisis plan. Offer practical assistance when needed, but avoid doing everything for them. Encourage independence and self-reliance. Ask your loved one what they need and how you can help, rather than taking over their responsibilities. Take care of yourself. Learn to recognize the warning signs of a relapse. These may include changes in sleep, mood, or behavior. Help your loved one develop a crisis plan that includes emergency contact information, a list of medications, and preferred treatment options. Help reduce the stigma associated with schizophrenia. Use respectful language and educate others about the illness. Reduce stigma. Prioritize your own well-being. Supporting someone with schizophrenia can be emotionally draining, so it's important to take care of your own mental and physical health. Join a support group or seek therapy for yourself. If your loved one is in immediate danger, seek professional help. If they express suicidal thoughts or are a danger to themselves or others, call 911 or your local emergency number. Know when to seek professional help. By following these steps, you can provide valuable support to your loved one with schizophrenia and help them on their journey to recovery. Schizophrenia, to medicate or not to medicate, and benefits and risks. The benefits of antipsychotic medications are significant. Benefits of antipsychotic medication. Schizophrenia is a serious mental illness that often requires medication to manage symptoms and prevent relapses. Antipsychotic medications are the cornerstone of treatment, primarily used to alleviate symptoms of psychosis, such as delusions and hallucinations. These medications work by altering the activity of neurotransmitters in the brain, particularly dopamine, which is believed to be overactive in individuals with psychosis. Reduce or relieve symptoms of psychosis, help people feel more in control of their lives, prevent further episodes of psychosis, improve quality of life, reduce the risk of relapse. Risks of antipsychotic medication. Research suggests that antipsychotics are successful in treating symptoms for a majority of people with severe mental illness. Studies show that psychiatric medications are most effective when combined with other treatment methods, such as psychotherapy. While antipsychotics offer substantial benefits, they also carry potential risks and side effects. These can vary depending on the specific medication and the individual. Common side effects include informed decision-making. It's important to note that not everyone experiences these side effects, and the severity can vary. Healthcare professionals can help manage side effects by adjusting dosages, prescribing additional medications, or changing the type of antipsychotic. Drowsiness. feeling tired, sedation, loss of motivation, slowed thoughts, emotional numbing, weight gain, movement effects such as tremors, muscle stiffness, and tics, tardive dyskinesia, TD, a condition causing involuntary movements, which can be permanent, increased risk of diabetes and heart disease, suicidality. The decision to take antipsychotic medication should be made in consultation with a healthcare professional, considering the potential benefits against the risks. It is crucial to weigh the benefits of symptom relief and relapse prevention against the possibility of side effects. Open communication with the doctor about any side effects experienced is essential for effective management. Conclusion: antipsychotic medications are a crucial part of treating schizophrenia and other psychotic disorders. While they can have side effects, the benefits of managing symptoms, preventing relapses, and improving quality of life often outweigh the risks. The best approach involves a collaborative effort between the patient and healthcare provider to find the most effective medication with the fewest side effects. Thank you for joining De-Novo Education Pty Ltd.